Hi, Ms. Johansson.
Hi, Michael. This is Doris from Commonwealth Care Alliance. How are you?
Based in Massachusetts, Commonwealth Care Alliance is an integrated care system influencing innovative models of care nationwide. We're a not-for-profit, community-based payer and provider with $1.8 billion in managed premium. We serve over 40,000 individuals with significant health needs. Our innovative care model is proven effective in addressing unmet social determinants of health, behavioral health, and medical needs. But when the COVID-19 pandemic struck, CCA was put to the test. We knew we had a healthcare tsunami coming at us, and quickly, but we were ready with a crisis playbook, and we executed it very well. Guided as always by our mission to improve the health and well-being of those we serve, CCA decided from the outset to focus on getting care to those who needed it. We would put people first and worry about reimbursements later. Virtually overnight, our 1,500-person workforce pivoted from field and office-based activities to fully remote operations without missing a beat. Adopting a range of in-person telehealth and virtual care technologies, we achieved nearly 1.5 million member interactions, averaging 35 touches per member. We committed to keeping our primary care facilities open during the pandemic to serve patients on-site. For those who continued to need hands-on medical care, we assembled an interdisciplinary CCA field team to provide care at home and to help prevent community exposure and avoidable transfers to acute settings.
CCA has been great. Their care is phenomenal.
And early data suggest our member engagement has been remarkably successful. Our efforts helped reduce hospital admission rates by 17% for our Senior Care Options members and 11% for our OneCare members. And by our calculations, we estimate that in 2020, CCA potentially avoided over 3,000 COVID infections and 750 COVID-related deaths by keeping the vast majority of our SCO members out of long-term care facilities.
How are you doing with food right now?
As the pandemic and our outreach unfolded, we also discovered that many of our members' most urgent needs were not medical, but rather for everyday items like food, paper goods, or cleaning supplies. We quickly created and funded a $4 million member support program to give every member $100 toward those needs. Because of our well-known success in engaging marginally housed individuals, the state reached out to CCA for help with this COVID-positive population. In under 24 hours, we helped develop and then managed a program that converted 6 hotels across the state into isolation and recovery centers.
On April 1st, the Command Center in MEMA launched the first regional isolation and recovery site in partnership with the Commonwealth Care Alliance for homeless and housing insecure individuals that test positive for COVID-19.
Throughout this pandemic, our highest priority and our greatest achievement has been keeping people safe. Although we've begun vaccinations for our members and staff and hope that we're finally seeing an end to this public health crisis, there are still many unknowns. But one thing is certain, CCA will be well prepared and will continue rising to the challenge, whatever the future may bring.